The SAMHSA Technology Challenge solicits new ideas to prevent opiate overdose. We created the Opiate Overdose Prevention app from a section in our original app named You Are Linked by taking 2,000 of its 15,000 links and adding the 5 steps and assets required by the rules. When I showed Dr. Wesley Clark, formerly with SAMHSA, our app 2 years ago, his first question was, "Is our toolkit in the app?" And now I'll show you. Our Opiate Overdose Prevention app includes SAMHSA's 5 essential steps for first responders to treat an opiate overdose quickly with easy access to the steps. We created this app with the steps from the toolkit, illustrated with photos of each step and a link to dial 911. After calling 911, check for signs of an overdose illustrated in the app. Our app shows clear visuals of the next step, rescue breathing, to prevent acute lung injury. Next, use the naloxone dosage and frequency from the toolkit, along with our app's handouts, including photos to administer naloxone. After the naloxone is administered, the patient must be monitored to see if a second dose is required. Then the SAMHSA assets provide locations for treatment. Our app then provides the next step, links to treatment directories and questions to ask. Opiate Overdose Prevention Assets is the large button on the bottom of the home screen. SAMHSA included 34 assets such as phone numbers, websites, articles, and support groups. Samples include Washington State's web resources for naloxone, naloxoneinfo.org, In the Rooms, SAMHSA's National Helpline, and Stop Stigma Now's website. To make SAMHSA's assets more accessible, we created a search section that organizes the assets in various ways. These ways include category, targeted demographic, and type of resource, article, website, etc. In addition to SAMHSA's assets, we've included other assets from our original app. Articles about first responders being trained and using Narcan. Under distribution models, we also have 6 types of people and organizations who are distributing naloxone and saving lives. These include peers, treatment centers, and churches. Different ways of administering, including the new intranasal currently being fast-tracked through the FDA. Pinterest boards with over 300 first responder pins and 400 pins of people saved by Narcan. More links to awareness and training, including Narcan Funk, a YouTube video for young adults. Additional toolkits include the Law Enforcement Toolkit and Facts for community members. As a part of our response to the technology challenge, we created the FDA Naloxone Uptake Workshop app. It demonstrates our hope that we can prevent overdoses by sharing the latest information. Last October, Michael Botticelli spoke at the National Harm Reduction Conference, which was a first step in uniting the communities that work on opiate overdose prevention. At that conference, I sat by Pam Lynch and her children as they sold T-shirts. She was one of the harm reduction leaders speaking at the FDA Naloxone Uptake Workshop, a second step in uniting the efforts. Having federal and harm reduction groups work together gives us hope that we can save lives by preventing overdose deaths. One of the 9 panels covered law enforcement, their new toolkit, and what is working in North Carolina. Even though there are nearly 22 million Americans with substance use disorder and over 100 million affected by it, we usually reach groups in the addiction and recovery community through Facebook pages of only 4,000 to 5,000. Americans in Recovery post excellent resources on their Facebook page, but they have less than 4,000 likes and have only posted 3 times since the 1st of June. These Facebook pages are leading the way in sharing information and support. No Heroin in Heaven reached over 16,000 likes in 3 months. I Hate Heroin provides support to over 109,000. The addiction and recovery community is not effectively disseminating the latest evidence-based research and experience, exemplified by the National RX Drug Summit in April. Michael Botticelli's video was published on May 21st, but on July 13th, it only had 6 views. By spending $20 on Facebook post promotions, we increased his views by over 100. We created the Your Link to the Opiate Overdose Prevention app to share the SAMHSA 5 steps and assets, and also the additional resources from the original You Are Linked app. We believe that to prevent opiate overdose, we have to share the latest practices and evidence-based research, with an increased emphasis on widening our audience from a few hundred or thousands to target the 100 million affected. We have included many of the 900 sections from the full version of our You Are Linked to Resources app, but check out the original app to see the sections about medication-assisted treatment, Gloucester's police department model, and syringe exchange.